Yeah, for all you out there who don't know me, I'm Zach Shenk. I'm the medical programs coordinator here in Mao, and I'm really excited to be with you guys this evening and be able to share with you all of the updates that have been happening here in the DR. I'd like to start off, saying that it was really disappointing when, we started getting the news that you guys weren't going to be able to travel and what that implied. Initially kind of thinking about hoping to do a brigade basically with all local volunteers, kind of reaching out to other institutions in the area. And we had that going for maybe a week or so before we realized that that also wasn't going to happen because coronavirus, COVID-19, definitely made its way to the Dominican Republic and has been spreading pretty consistently throughout the country. Some areas, of course, more affected than others. But so I'll just go ahead and start diving into everything that I've got. Thank you, by the way, Emma, for passing along this like kind of tentative agenda. I basically just built all of my notes off of the things that you had talked about, and then kind of added a couple points in as well as I saw fit.
How you doing?
So, is that you, Joey?
That is me. Hold on one second.
Hey, how you doing?
I'm doing good. How are you?
Doing well. Good to see you.
Good to see you too.
Also, I'd like to start off as well by saying that I hope that everybody is doing as well as they can be right now. I imagine that a lot of people are in a lot of different places, and yeah, I just hope that you guys and your families are all safe. And for me myself, I'm feeling very privileged in these times, being able to work remotely first off, and then also just have the ability to stock up on food and just have a roof over my head, have basic necessities, running water, things like that, that I can, wash my hands with ease. That, thinking a lot about our communities, that these aren't things that many of our communities have access to or have the ability to, be practicing on a regular basis. So yeah, I was just reading a really good article today about how, social distancing in and of itself is a huge privilege. So I hope that you guys are doing as well as you can, and I'm sending my best wishes to everybody out there and all your families. So yeah, so far in the DR, we have 1,956 confirmed cases. We've had 36 patients recover, and we've had 98 people so far that have died from COVID-19. Of those confirmed cases, 228 are currently in isolation at either like a hospital, or basically the Ministry of Health has habilitated some areas. They're not exactly being super transparent about where they are, which is probably for the best. But basically, for anybody that doesn't have adequate conditions to be isolated in their homes, they've been transported by Ministry of Health personnel to these kind of centers where they're able to isolate all of the COVID-19 patients. But otherwise, the vast majority, more than 80% of the confirmed cases, approximately 1,500 people, are actually just in isolation at their homes. So the Ministry of Health has a bunch of epidemiologists that are essentially in communication and following up with all of these people that have called to let them know that they're feeling symptomatic, and they're providing them information about how to maintain proper isolation at their house, and maintaining the health and well-being of everybody else that's around them. So being confined in their own room, having exclusive use of possible their own utensils and that type of stuff, and then basically making sure that everybody at that house has masks to be able to use. So that is just the basic numbers. But we all know, I'm sure, as seeing in the United States as well, that the testing capacity is a huge issue of concern, right? So I was just reading that the World Health Organization has basically set a benchmark for adequate testing, which they say is for every positive test, you should be receiving 10 negative test results. So at this point, I did a quick little bit of math, and the DR as of right now, for every positive test, they have 2 negative tests. So you can kind of deduce from that there's a huge lack of tests available, and there's likely a lot more people that have COVID-19 than the numbers are reporting. They do have, at first they really only had like 2 or 3 laboratories that essentially were authorized to be performing the test, and they have since added a few more laboratories to the list. So it appears that they're trying to ramp up testing ability. They actually received a huge shipment of rapid tests around the middle of last week, but it turns out that these tests aren't quite as precise or reliable as the RT-PCR test, which has basically been the standard up until this point. So just to give a brief example of that, within the last couple of days, there were 9 doctors that were working at this one hospital that were tested with the rapid test. They tested negative, and all 9 of them are now showing symptoms. So the Ministry of Health said that they would be continuing to use the rapid test, but then they would be confirming all of those results with the PCR test. So I'm not really sure how that's treating them so far. It sounds like there's a really large quantity of individuals that are soliciting tests. The Ministry of Public Health has reported that people will wait a maximum of 9 days to be tested, but on average, people are waiting about 3 days to get tested. And there's this whole long process. Basically, you get into contact with the Ministry of Health via phone. They're publishing their number on social media via WhatsApp and via Instagram and Facebook. And then basically you call and you're on the line with an epidemiologist, and you go through kind of your symptoms and what you're feeling and all that good stuff. And then they determine, whether you'll need to be tested or not. So I think that that's also leading to kind of these numbers that aren't totally realistic, because maybe there's lots of people out there who are showing symptoms, but just the Ministry of Public Health hasn't been able to deal with a huge, just doesn't have the capacity to deal with all the people that are asking to get tested. As far as just like hospital capacity and like resource availability, I don't have a lot of exact numbers as to ICU capacity, like number of ICU beds in the whole country. But I did hear a figure in Mao that between the 2 public health facilities, one which is just a normal hospital, and then one which is has been converted into a maternal and child health hospital, or maternal and infant health, excuse me. Between those 2 public health facilities, so those would be free to anybody, there are less than 30 ICU beds. I would probably say closer to 20 or 25. So of course there are more ICU beds and more capacity in private facilities, but not everybody has the economic resources to utilize these facilities, especially a lot of our patients. Let's see. There's an area of the country called San Francisco de Macorís, which currently has like the highest mortality rate, and they've been doing a lot to like habilitate other spaces for ICU care and other areas for patient isolation to keep up with the high demand. We've been hearing that here in Santiago, which is the 2nd largest city in the country where everybody would have flown into, there have been hospitals that are turning away COVID-19 patients. There are a number of teaching hospitals around the country that are assigning just the residents to COVID-19 patients. And really, even before all of this happened, there were already a lot of material and healthcare worker shortages in the whole country. I think just a general lack of government funding. This has been a standard. Lots of hospitals and clinics are saying that they don't have enough personal protective equipment, particularly for their frontline healthcare workers. And a lot of nurses are the ones that are really having to deal with this. I think that I've heard, at least in Mao, getting in contact with our BANELINO staff and our BANELINO nurses and just kind of seeing what they've been hearing through their fellow colleagues, that just nobody really has enough PPE. So I actually saw that as of today in the country, there have been 55 confirmed cases of doctors that have COVID-19. So hopefully the government can ramp up, resource acquisition. I will say it has been politicized very significantly. There are presidential elections that are supposed to be taking place later this year. So as you can imagine, there are a number of candidates that are donating huge sums of money, personal protective equipment, and like other materials, ventilators as well. So it's a good thing, I guess, but definitely seeing a lot of virtue signaling in that respect. But the government is also offering money to medical professionals that are willing to help out. They're offering about the equivalent of about $200. So I don't know exactly for how long that would be, but they're doing what they can to recruit as many people to basically just have all hands on deck. Are there any questions so far? I know that it's a lot of information.
So at the beginning, you mentioned that they were taking individuals that weren't able to self-isolate to a certain facility. Considering like the kind of racism towards people who aren't Dominican, do you think that that might impact those communities in a different way?
Absolutely.
About that?
Yeah, I think that they would definitely prioritize taking Dominican patients over taking Haitian patients, and even then taking, Dominican-born patients that are of Haitian descent. That I think that I mentioned briefly in our pre-trip call, but just kind of, in 2010, there was the change in the Constitution that essentially made it so that anybody who wanted to be considered a Dominican citizen had to be able to show not only their birth certificate, but both of their parents' birth certificates, showing that they were both born in the Dominican Republic. So that essentially created a group of, at least 200,000 to 300,000 Dominican-born, previously considered citizens that are of Haitian descent that are no longer Dominican citizens. So yeah, Emma, that's a really good question. I definitely do see this being grounds for discrimination, and that those individuals will likely receive a lot less attention and just access to the resources that the Ministry of Public Health is offering. I'll get into it in a second, but basically one of the resources that the government is offering is, they basically come up with an app, like a telemedicine app, that you can access via WhatsApp or via like Facebook Messenger. And they have about 230 doctors that are on call 24/7. And so in I think it's been about 5,000 like consults. And so I don't even know if there are any doctors or any medical professionals that are using this that speak Haitian Creole. So automatically, the people that don't speak any Spanish are going to not be able to utilize that amazing resource that's available. So yeah, those are definitely just a couple examples of likely how many of our communities, being largely Haitian, will receive less overall attention and less care and less access to the aid that the government is offering. That's a good question.
Thank you.
Yeah. So now I'll dive into the government's approach to all of this. So as of March 17th, the government said that they were going to be closing all land, sea, and air borders with the exception of, like essential supplies, food, oil, medical supplies that are coming in. But I have recently learned that there are still daily flights that are leaving the Punta Cana airport, which is a tourist hotspot in the southeast part of the island, and from the capital. The Santiago airport actually has been closed since March 30th and will be closed until April 12th. And the government is also trying to arrange flights for a lot of Dominicans who have been stranded in other countries who are still looking to return home. So as far as air, I guess the borders don't seem to be entirely closed, but it does sound like the land border between Haiti and the DR has been closed. And so a little bit later, I'll get into, a little bit more of the numbers of how many Haitians have been reported to have been leaving the country and kind of what that's looking like. The government additionally has implemented a curfew. So as of March 20th, the curfew was from 8 p.m. to 6 a.m. And then after 15 days, it was extended from 5 p.m. to 6. And it has since been extended for 15 days more. So from April 3rd from April 3rd until the 18th, it will be from 5 p.m. to 6 a.m. And if things continue on the path that they currently are, I see that continuing to stay in place. A lot of people have been talking about doing a 24-hour curfew, full lockdown, but that has yet to happen. So in the 18 days that the curfew has been active, this stat still blows my mind. The National Police have detained just about 30,000 people. So by and large, it sounds like the social distancing is working fairly well, but there's still obviously a number of people who aren't taking it quite as seriously. And right as of now, there's technically no real legal consequences to being detained or from violating the curfew. I think that they're going to try and start fining people and making people do community service once everything kind of calms down. Another thing that the government did was declare a state of emergency. So on March 19th, they declared 25 days of a state of emergency. And then just this past Monday, or I guess that was yesterday, another 25-day state of emergency was approved by the Congress. So that'll last from April 14th until May 9th. The good news is that basically allows the government to access a whole bunch of money that they then can use to buy more supplies and also to beef up their social welfare programs that they currently have in place. So they have basically kind of like a food stamp program, but for basic supplies that basically Dominican families who are living in poverty or extreme poverty receive like this little card. And then every month the government puts on to this card a certain amount of money. So as of right now, there are 1.5 million Dominican families who will receive an increase in this monthly allotment of money. So it was about $27 per month, and it'll now be $92 a month. But like I was saying earlier, these benefits and this card, this social welfare system is not available to any of our Haitian patients or any Dominicans of Haitian descent because of their citizenship status. Part of the state emergency also includes all non-essential businesses being closed. So just for example, there are a lot of individuals here in the country that their main source of employment is essentially being an ambulatory vendor. So they'll be out on the street, they'll be selling some fruit or, products. And so now basically a lot of people are having to still stay out and try and sell their products, risking being exposed to COVID-19. But, basically if they don't have money to pay for food and basic necessities for their families, what are they going to do? A lot of people just don't have that privilege of being able to work from home or stay at home all the time. Actually, 80% of the agricultural and construction workforce here in the DR is made up of Haitians. So a lot of agricultural businesses continue working, but they've all kind of been instructed to basically minimize the number of workers that they're having in any given area. I think that they've instructed most businesses to cut their workforce by 50% if possible. And then they're also encouraging basically constant disinfection of work areas and, physical distancing of at least 6 feet between workers at all times. But the bad news is that construction projects have been deemed non-essential. So these workers are out of work and no longer have any income to support themselves or their families. There was actually an article that I read recently with the title that actually came from an area in the capital city where somebody had written on a wall in chalk. They wrote, I'll translate it, but they wrote Corona or food. So basically there's a lot of people, not just Haitians, but Dominicans as well, that are saying essentially, either we're going to die of coronavirus or we're going to die of hunger, because there's a lot of food insecurity for the most vulnerable and marginalized populations. In the capital, not quite as much food insecurity in most areas, but especially in where our communities are out in the rural areas, definitely you could consider those food deserts, I would say. And lastly, all non-essential interprovincial travel here in the country. So the country is made up of 24 different provinces. And it's actually Holy Week right now here, which has been a big deal, that now nobody is able to travel. Usually people will go out to the rural areas and visit their families and do that and celebrate Holy Week with their families and loved ones. But the military now has stations up strictly regulating travel. So it is only essential travel that's allowed. And also you can't even go to any beaches. You can't go to any pool or spa or any large congregation of people is prohibited at this time. So fairly strict measures here in the DR. Does anybody have any questions about those?
I have a quick question about the employers and
Yeah.
Sorry, so I know here that a lot of companies are still paying their workers even if they're not working. They're still giving something to their workers.
Yeah.
So a lot of people are cutting their workforce in half. Are they giving anything to their employees or not really?
No, I don't believe so. I don't think that there are a lot of plans in place. Maybe part of that state of emergency money is going to be used to kind of reduce the economic effects of that, but I don't believe that there's a lot of protection. Agricultural workers or construction workers who are likely going to be, the most vulnerable and marginalized populations and will also suffer the most as a result of this. I would imagine that some businesses like banks and stuff, if they've had to reduce their workforce, they might be providing some economic relief to their workers. But I haven't really looked into that quite as much.
Thank you.
Yeah.
Well, kind
Good
of,
question.
I guess, bouncing off on that question.
Okay.
A lot of people in the DR and like in a lot of Latin American countries live day. So has there been like any increase in like crime rates or stuff like that?
You know, I haven't seen any reports that are really specifically detailing whether that's taken place, but I've seen a couple stories about people taking advantage of COVID-19 for sure. I saw like basically a couple of apartment complexes that had to emit basically a notice to all of their tenants saying not to let people into their homes, because what was happening was people were going around dressed like in, you know, full PPE, and they were saying that, you know, we're part of the Ministry of Health and instructed to come and disinfect people's homes, and they were saying that they would do it for free. And so, but I would imagine that they were probably saying something like, oh, you know, we need you to be out of your house. We're going to be using some caustic chemicals. So if you could be out of your house for 2 or 3 hours and then come back, we'll make sure that your house is spotless by the time you come back. And then they would just take all of their stuff in their house. So yeah, pretty horrible. I only saw a couple instances of that, but I can't say about whether overall crime rates have increased. I don't know if it's really gotten to the point yet where that might happen, but I can definitely imagine that it will, given, you know, I was talking about the food insecurity. I think that that's going to play a huge role, especially in the capital. But the government continues to reassure its citizens, saying that they will make sure that there is plenty of food for everybody. And the DR does produce a significant amount of food that they typically would be exporting. So I think that overall there's going to be a decent amount of food to go around, but I wouldn't be surprised if some areas do see an increase in crime over, you know, access to basic necessities like that. Yeah, that's a really good point, Marcos. Thanks for bringing that up.
Thank you for answering that question.
Yeah. Let's see. Now I can talk a little bit about what we're doing with BANELINO and kind of how BANELINO has been approaching this whole situation. So BANELINO being, you know, kind of an interesting institution where a fair trade organization, banana production is kind of its number one priority, you know, and of course the bananas are continuing to mature, and so that process definitely doesn't stop. There's still a lot of demand for bananas abroad, so that those haven't stopped. But you know, basically valuing our community health promoters, BANELINO is not willing to expose them to the risk of COVID-19. And so essentially what has been decided is that they will work from home. BANELINO, the vast majority of BANELINO's employees, if possible, will be working from home. Like all of their office staff are working from home. And then the community health promoters are also essentially working from home, but we're really working a lot with them to coordinate education. So that is another thing. We're really, we're not only fighting the virus here, we're fighting misinformation. I don't know if you guys have heard about that, and if this is also, I imagine, something that's happening fairly frequently in the US and places all over the world. But there's just so much false information, fake news that's being spread very quickly through WhatsApp and other social media platforms. And so that's for us become, and for BANELINO, become a real priority, making sure that people have access to relevant, valid, correct information that's being published by trusted sources. So we're looking at a lot of sources from the World Health Organization, from the Pan American Health Organization. We're working with our marketing director at Timmy as well to help us develop some more kind of specific imagery and materials that we'll be able to translate both into Spanish and into Haitian Creole to then be able to share that with our BANELINO network. So what we've done is we've kind of created these different networks of communication. So we have our doctors, our BANELINO doctors, both here in Mao and in Montecristi, our other Timmy site, and then all of our community health promoters. And so the BANELINO doctors are in constant communication with the community health promoters, and then the community health promoters have big groups of on WhatsApp with all of the community members, or as many community members as have access to a phone and WhatsApp. And so basically through just virtual communication, sharing as much information as we possibly can, preventative measures to be taken, what COVID-19 is, how it's transmitted, what the symptoms are, what to do if you or a family member suspect that that you have COVID-19. And as I was saying, as of this past Friday, that the DR government has set up this telemedicine service, which also, I forgot to mention, has mental health professionals, both psychologists and psychiatrists, that are available. available. So that is has been very popular, and I think that has been producing some really good results as well. Like I said, we're still trying to figure out if there are any Haitian Creole speaking professionals available. And if not, then basically we're going to be instructing our community members to essentially communicate with our community health promoters, who will then act as interpreters to interpret all of the information to the medical professionals on the other line, and then just serve as a bridge of information and relay that back to our patients to make sure that they're receiving all the information. So as I mentioned, that the vast majority of BANELINO staff are working from home, but in Mao, since we do have our clinic, Dr. Nieves, our nurse Nena, and our laboratory tech Iris are still working. Basically, it's only open from 8 a.m. to 11 a.m. Monday through Friday, and it's really only for emergencies. But they're still in the office and making sure that if somebody does come by, that they're able to help them as best they can. Another key piece of what we've been doing with BANELINO has been making sure that our most vulnerable populations have what they need. So in this case, what we've been seeing is that the most vulnerable populations at this point are our patients with chronic conditions. So diabetes, hypertension, anemia, things like that. So basically, we have been coordinating with our community health promoters and with the BANELINO field technicians who are constantly out in the field. They've been working together to distribute these meds to our chronic patients. So we've started off kind of just distributing a 30-day supply. And we've been very cognizant that we're making sure that it's that we're taking all the proper precautions to make sure that this delivery is as safe as possible, using proper protection. And we've established a way of getting it to the chronic patients without actually out family members or trusted community members who are at less risk of suffering complications from COVID-19. And we've been able to give them the meds, and then they are able to deliver them to our patients. So we've been working we've done an inventory of all of the chronic meds and all of the PPE that we have, and kind of just looking at, how long that's going to last us. And so proactively, we've been contacting some local laboratories to start getting some estimates on medications that we could potentially start buying here in country. Because obviously, without having you guys come down and bring all those meds that we were looking for, and, assuming that potentially we might not even have a group that's able to travel in August, this has been something that we've been looking into for quite some time, and this has just been the impetus to really start basically creating a budget that will then propose to our medical advisory committee at Timmy, and detailing all of the in-country chronic med purchases and PPE purchases that we would need to be making to essentially ensure that our chronic patients have all of their medication, and that our BANELINO staff who are having direct contact with patients, typically not COVID-19 patients, but any patients in general, especially our community health promoters, making sure that they have all of the PPE that they would be needing. So we have given them personal hygiene kits, including, gloves, surgical masks, hand sanitizer, soap, anything like that they would need if they were in contact with patients, and just to make sure that they're safe if they do need to go out into the community to contact a patient or anything. But like I said, BANELINO just doesn't want to put any of our community health promoters at risk, because then they could expose their families. And there are, as you may know, just a lot of people here in the country that suffer from chronic conditions. So we're trying to be as responsible as we possibly can, just kind of focusing, like I said, on education, making sure that people have access to reliable information, and serving as a connection to the Ministry of Public Health as much as possible, maintaining contact with them. And at this point, I'm happy to say that none of our communities have reported any cases of COVID-19, both in Mao and in Montecristi. So that's pretty promising as of right now. But, of course, prevention is what's really most important, and being as prepared as possible for what could happen and what is seeming to be eventual at this point, with the way that it's been spreading. There are, at this point, only 10 confirmed cases in the whole province where Mao is, and there's only 3 confirmed cases in the province where Montecristi is. Like I said, taking the numbers with a grain of salt, but it sounds like, from daily conversation with our community health promoters, many of our patients are taking this pretty seriously and are doing what they can to keep themselves and their families safe. Sorry, give me just 1 second. It's getting dark and I didn't have the lights on. That's better. Does anybody have any questions about BANELINO's strategy and kind of where we're fitting in along with that, and how Timmy is supporting BANELINO in all of this?
I do have a question. So
Okay.
I know that BANELINO is also has an education network to say.
Yes.
Do you know what they're able to do and what they are doing to continue educating students?
So BANELINO technically isn't the one that's providing the education, but they do support 9 schools. At this point, they haven't really mentioned a lot of what they're doing to continue supporting the schools, but most of those schools, if not all of them, are technically public institutions. And so all schools at this point have been closed in the country and have switched to virtual classrooms, which obviously is likely not an accessible solution for many of our community members and their kids. So that's something that I still need to check in with BANELINO about and see if they have any initiatives and what they're doing to make sure that people are as best supported as they can and that the kids are still being supported. But at this point, I do know, yeah, that the government has been saying that everybody should be doing these virtual classrooms. They set up a bunch of websites and an app and all this stuff. But I haven't heard how that's going. Actually, my partner works at a private school in Santiago, and they've also made the switch to the virtual classrooms, and things are going all right. But you know, keeping in mind that in a private school, that most of those families are going to have a lot better access to the technology and anything that they would need to continue getting a quality education. And it's still been difficult for the private school to kind of go through this transition. So I would imagine that the public school is also dealing with some issues. But my partner has some cousins that live here, and she's said that they're still doing work, but yeah, I'm not sure how exactly that's all playing out.
With that said, could you imagine that they would extend classes to the summer for public schools?
So I saw somewhere saying that they were thinking of extending it into like December, just because we really don't know how long this is going to go on. But I honestly don't foresee that happening. I think that more likely than not, they would just cancel the rest of the school year and then kind of just wait and see how things play out. And theoretically in September, kind of, or I guess August, start reevaluating whether it would be in everybody's best interest to start sending people back to physical classrooms. Yeah, I'm not so sure about that.
Thank you.
That's a good question. A lot of good questions. I hope that I have some answers, but I know that I definitely don't have them all. So I appreciate your guys' patience and understanding. And so kind of the last part that I have here, a little bit, just kind of talking a bit about the impact of COVID-19 on the population that Timmy serves, which, we've kind of been talking about a little bit already, but also on Haitian nationals in general, Haitian migrant workers, climate refugees, as they're technically being called now, just because, Haiti is one of the most affected countries in the Western Hemisphere by climate change. So Haiti actually closed its borders technically before the DR closed theirs. So before Haiti even had a single case of coronavirus, they had already technically closed their borders. According to some news sources that I've been looking at, they've estimated that a little bit more than 4,200 Haitians have recently returned to Haiti. Talking with some of our community health promoters, it sounds like a number of our community members have returned to Haiti, likely to be with their families during these difficult times. And the most updated information that I could find was published just this past Sunday, detailing that Haiti does have community spread of COVID-19. They have 24 confirmed cases and 1 death. But, just as here in the DR, I think that the numbers are likely quite inaccurate just because of testing capacity. And I've actually heard from a couple of our community members and interpreters who I've been trying to stay in contact with, just to kind of, see how they're feeling and see how our communities have been feeling about this. At least in one of our communities, I was just hearing from an interpreter today, or actually no, the other day, that a lot of people just don't believe that COVID-19 is real. A lot of people, out in the rural areas, there's not a lot of police to be enforcing the curfews. So people are still out and about at night. People are still going to work during the days. I actually reached out and I'm waiting to hear back So I'll keep you guys posted on, now knowing that there have been confirmed cases and a death in Haiti. Just kind of interested to see how people are feeling about that now, and how many of our Haitian community members are understanding this. And so that's, like I was saying, just kind of the whole, these crazy misinformation campaigns that are all over the place, not just in our communities, but I mean, my partner's family members have a group chat, and they've been sending all sorts of stuff and all these conspiracy theories and stuff, so it's really, it's a battle, even just making sure that people have access to the right information. So that's been really interesting to see how that's been playing out here. But kind of just more specifically with regard to our communities, and just thinking about our community layout, and I've just been thinking a lot recently about the social determinants of health. So basically the conditions in which people are born, live, and die that contribute to their quality of life and their health throughout their lives. And really, not just here, but even in the US, just seeing this play out and seeing just how pervasive this is, and how much systemic racism and discrimination has been playing a factor in all this. So, thinking about the limited transportation options in general to a lot of our communities, a lot of the military checkpoints that would make it so that anybody that didn't have proper documentation, that they were not able to leave their communities for fear of being detained and sent back to Haiti. Now there's no transportation that's available, aside from maybe, there might be some taxis, like motorcycle taxi guys that are still out in the rural areas if people need to go get food and stuff. But otherwise, there's really no public transportation available. And so what does that mean? There's just super limited, and likely for a lot of our community members, really just no access to healthcare facilities. Additionally, a lot of our community members live very close to one another, living right next to your neighbors, living with, 3, 5, 7 people in a very small space. You can imagine how difficult that would be to prevent the spread of COVID-19, which has proven to be just so hard to contain, and especially once getting into such a densely populated area. So that's another, vulnerability that our communities are experiencing. As I mentioned earlier, that a lot of our communities are in one way or another food deserts, that the access to fresh fruit is pretty minimal, aside from, bananas and plantains, which are everywhere. Access to fresh veggies is also very minimal. And so just the availability of the junk food, the processed packaged foods that are all over these more marginalized communities, it just kind of, you see that vicious cycle playing out, in that people aren't able to maintain their health. Why do we have so many chronic patients in the first place? Because they really only have access to these foods that are of very little nutritional quality. Another example, a lot of shared sanitation facilities, a lot of basically latrines that a lot of members of our community will share. And similarly, very limited Uh-oh. Can you guys hear me now?
Yes.
All right, where did I cut off? What's the last thing that you heard?
Sanitation facilities, I believe.
Okay, yeah. Yeah, so just kind of keeping in mind that, you know, a lot of there are limited sanitation facilities in most of our communities that ends up being a latrine, and there are a lot of people using one facility. And then again, access to running water is very limited. How do you expect people to wash their hands frequently when they don't even have access to running water, or they only have access to running water for you know, maybe a couple hours out of the day? So that's just another vulnerability of so many of our communities, and that our community members are facing. And so what else? You know, at this point, we're still trying to be as cognizant as possible of the most vulnerable populations, not just our patients that suffer from chronic conditions, but older individuals that don't have chronic conditions, pregnant women, and children under 5 are still, you know, very much on our mind. But sadly, at this point, we are not really able to provide any critical care for those community members. So if something were to happen, they would likely need to do what they can to access their local healthcare facility. And, you know, in emergencies, a lot of the military that are usually at like these checkpoints do let undocumented individuals pass. But still, there's still, you know, with a lot of the healthcare facilities already being understaffed, under-resourced, this is a really difficult time for a lot of people that might not be dealing with COVID-19 related issues as well. Hello.
Hello, we can hear you.
Okay. What was the last thing you heard this time? Thank you, Jazz. Maybe I'll switch off my video, and hopefully now it won't kick me off the call. But yeah, I was saying that basically, as BANELINO and Timmy, we're gonna do what we can to ensure that we're still able to provide basic medications to any patients that would be able to make it to the Mao Clinic. But like I said, we aren't able to. We don't want to expose our community health promoters at this time, and so they aren't doing their typical house visits that they are usually carrying out, checking on our chronic patients, checking on our pregnant women, checking on young children, and making sure that they have what they need. So similarly as the US, you know, there are just a lot of shortcomings in the DR's healthcare system as a whole, and we're just really seeing that amplified as a result of all of this now.
Thank you very much for joining us tonight, Zach. And
Of course.
on
Thank you
a
for
more
having me.
positive note, my last question was, do you expect that the Dominican Republic will increase funding and investment in public health resources in the future?
I really hope so. Yes. I think that this is definitely a wake-up call for a lot of countries around the globe, and especially in the DR, where a lot of medical professionals don't really feel valued in their profession. And that's shown in, like I was saying, being under-resourced and understaffed for in a lot of healthcare facilities. So I truly do hope that the government is now able to dedicate and allocate a little bit more money to preventative health and public health initiatives, and making sure that they have what they need to be more prepared to take on emergency situations like this, because oftentimes the healthcare system here, and from what I've been reading, honestly, in the United States as well, the healthcare system is essentially running with just enough to get the job done, right? And so now when just enough is nowhere near enough, I think that this has definitely been a wake-up call that there needs to be some reformation in the government and how they are providing necessary equipment and human resources to their populations, and making sure that everybody does have fair access to these resources and to healthcare. So only time will tell, but staying hopeful. And I think that that's something that is really important in these times. It's really easy to hear a lot of these things and get pretty discouraged. So I encourage you all to do what you can to help uplift others and find positivity in anything that you can, and spread that as much as possible during these times that people really need it. So yeah, I really appreciate you guys having me on and letting me talk about all this stuff and give you guys all the updates.